Rheumatoid arthritis can cause destruction of your joints and also your organs, and many people are not taking it seriously enough. Hi, I'm Dr. Micah Yu. I'm a board-certified integrative rheumatologist, and I see rheumatoid arthritis every day in my clinic. In some cases, it's at the end stage of their disease. In today's video, we're going to be talking about the severe end-stage signs of rheumatoid arthritis. Rheumatoid arthritis affects many people in the world, and I see it every day in my clinic. And some patients, it's more mild and it's manageable. But in some patients, it's very severe, and even with medications, they're still having problems. Of course, you can use diet, supplements, herbs, and other integrative modalities on top of medications to treat and manage rheumatoid arthritis. But when this disease is untreated or at a very severe stage, it can come with very grave signs and symptoms as well. So for milder rheumatoid arthritis, you can see that the joint spaces are being narrowed on x-rays. But at a severe stage, you can start seeing destruction of the joint, where you actually start seeing bites or holes on the sides of the joints, showing more severe rheumatoid arthritis. And in some cases, you can even see fusion of a joint because there is no more cartilage between the joint and it's completely fused from advanced rheumatoid arthritis. And in some cases, you can see deviations of the joints where they go like this, where the hand goes to the side. And also you can see fingers that are not straight anymore from chronic severe rheumatoid arthritis. You can also see different versions of advanced rheumatoid arthritis, such as a swan neck deformity, a boutonniere deformity, which are different signs that you see on the fingers of more advanced rheumatoid arthritis. And in some cases, you can see a collapse of a finger because the tendon has been damaged there as well. With more advanced rheumatoid arthritis patients, they can get constant pain and swelling even at rest and with movement as well. If it's properly treated, patients should not be getting constant pain, typically with rheumatoid arthritis, unless it's refractory to treatment. And other signs of more advanced rheumatoid arthritis are rheumatoid nodules, where you actually see nodules on the wrist, the fingers, and in other places of the body, such as the elbow as well, from just inflammatory tissue building up from rheumatoid arthritis. It's called a rheumatoid nodule. Also, rheumatoid arthritis can affect other organs of the body, such as the lungs. It can cause something called interstitial lung disease, which is scarring and inflammation of the lungs from rheumatoid arthritis. I will tell you that I actually saw a patient before that came into the ICU with breathing problems and it had to be ventilated. We found that the patient had rheumatoid arthritis that was causing lung problems, and he never had joint pain, which is very uncommon, but it can happen. So please be aware that rheumatoid arthritis can affect the lungs, and the treatment for this is treating the rheumatoid arthritis. Also, rheumatoid arthritis can affect the eyes as well. It can cause inflammation and swelling of the eyes and redness, called scleritis, or even episcleritis as well, where the sclera, the white part of your eye, is inflamed. And I see this in my patients. They have to go to the ER for this. Usually the first time they get diagnosed is in the ER because it comes on all of a sudden. The eyes get red, it's hard to look at the light, and also they have photosensitivity and there's pain as well. So that is another organ that you need to know about for advanced severe rheumatoid arthritis. Also, there's something called Felty syndrome. Have you heard of this before? Well, Felty syndrome is pretty much rheumatoid arthritis and large spleen and low white blood cell together. This is a sign of severe advanced rheumatoid arthritis as well. And the treatment for this is treating the rheumatoid arthritis, but much more aggressively. So as you can see, rheumatoid arthritis at its advanced severe end stage forms can cause issues in different organs of the body. And don't forget, rheumatoid arthritis can actually increase the risk of having a heart attack. It can cause inflammation of the heart. So don't forget that as well. And you can get rheumatoid vasculitis, where the rheumatoid arthritis can cause inflammation of the vessels, causing rashes on the skin. And with all rheumatoid arthritis patients, if it's not properly controlled, you can have higher risk of osteoporosis, which is loss of bone tissue. And that can cause bone thinning at an earlier age because inflammation can eat away the bones, which is why you get bone thinning earlier with rheumatoid arthritis. So those are some of the severe end-stage signs of rheumatoid arthritis that you need to know about. And please try not to get to this stage. Please get treated, whether you get treated holistically or with conventional medicine, because I see end-stage signs in my clinic all the time. And it's very sad, and it's not reversible, especially when the fingers are twisted or the toes are twisted. So please get treated early, do not skip treatment, and please seek help. If you're interested in seeing me for rheumatoid arthritis for any chronic illness and rheumatology diseases, please visit my website, drlifestyle.org, where I see patients all through the US and internationally for consultations. I do in-person and virtual visits in Southern California. Also, you can subscribe to my newsletter if you want to learn more about integrative medicine and chronic illnesses. So please hit the like button and subscribe below if you enjoyed this video, and please comment if you have any of these signs and what you learned most about rheumatoid arthritis from this video. All right, I'll see you guys next time.